Hi, I'm Andrew Sears, and I'm the president of City Vision University. And in this lecture, I'm going to talk about emotional regulation, dialectical behavioral therapy, or DBT, and Christian recovery. So, some key concepts related to how this fits in with the Wounded Healers course is DBT uses cognitive behavioral therapy principles, but it's adapted to help people who experience emotions intensely to manage their emotions. Now, there can be a lot of reasons why people experience emotions intensely. One can be trauma. Another can just be their genes. They're kind of born that way. If you notice with kids, some kids are more emotional. They often grow up to be more emotional as adults. Some people can have psychiatric conditions that make that more difficult. So things along the lines of borderline personality disorder, or sometimes with bipolar disorder, or there's other disorders that people can have that just make it difficult to manage their emotions, right? Just recognizing that is really important. Sometimes it can be difficult to figure out, okay, was this caused by trauma, or was this caused by I was born that way, or is it caused by some current factors in my life? It's hard to tell. But one of the things to realize is similar to CBT, DBT can be well integrated and adapted to a Christian practices and worldview. There's a really good video. I was going to do a longer video on this, but I realized there's a really good video by another Christian therapist who talks about how DBT works within Christian worldview. And rather than repeat what he's saying, I figure you can just watch his view. Now, one of the things I like to do for each week is to talk about how emotional outbursts, how these different components kind of work together, and how this fits into addiction recovery. So often what's happening with in managing emotions really, the big ones that they sabotage is the healthy relationships and support network, and then the job and financial health and career marketability. So if you have an emotional outburst or impulsivity issues, then that can create a lot of challenges there. And one of the things I like to do for each of these sessions that's focused on a particular aspect of holistic recovery is I want to talk about how they relate to all the different other aspects. So in just as a summary, here's really a vision of what we're trying to do in managing our emotions. So, you have this pressure cooker analogy where I talk about, you can look up YouTube videos of pressure cookers exploding, and it's kind of catastrophic, right? And ultimately, if you keep the pressure cooker going and you never have a steam release, and the pressure cooker is flawed, it's going to have, it's going to explode. So what we're trying to do is find ways to have a steam release. We're trying to find ways to increase the containment of the pressure cooker. Those are really the two kind of summary. So you have daily worship and prayer as an emotional release, journaling as an emotional release, talking to friends and counselor in a small group is an emotional release, reducing stress from self-care, exercise, and nutrition. So honestly, this is the one that I feel like is the easiest to do. So if you can get through the managing, like you have these negative core beliefs that don't allow you to have boundaries and self-care, then you do the self-care, you do exercise and nutrition, and that's going to help you reduce your stress. And then you develop DBT skills, so mindfulness and distress tolerance. But unlike a lot of other spaces, so the direction on managing emotions, often this sabotages your health, sabotages your job, but almost all these other things contribute to managing emotions. So you work on your physical health, that's going to help hugely. So boundaries and self-care, processing trauma, and you have to do that once you're safe, and that's long-term and slowly, because otherwise it's going to increase the pressure in the pressure cooker. And as you do all these things, what it's going to do, it's going to, lower the pressure on you, and it's going to increase your ability to manage emotions. It's going to lower your cortisol in your body and lower other stress, chemicals in your body. And as you have that, you're going to have more resources to manage your emotions. With that, how that relates to the addiction cycle. The thoughts, negative thoughts trigger the emotional, trigger. And just to do this connection again, a lot of times what happens is we have these, broken ways of thinking, and someone does a minor offense to us and we inflate that hugely. Or, we have ways of viewing the world as the world's unsafe. We're going to be hyper vigilant. And then that makes it more difficult to manage our emotions. And these two are actually related because, hypervigilance is an emotional feeling and it's dictating the thoughts. And I've always viewed as, your emotions kind of determine the neighborhood that your thoughts are going to live in. So if you're having all these fear-based thoughts, that's coming from your emotions. How do you decrease the fear? That's going to be easier to try to calm down, decrease the fear than just fight off the thoughts, which often that can be like trying to fight through the tide. The tide's bigger than you. How do you get the tide to go down in general through managing your emotions? So that's how that works. So on managing your emotions, really, what we're trying to do, if this is the addiction cycle, we're trying to teach you the skills to deal with emotional dysregulation and to stop that. So, you get this emotional trigger, and that could be stress, but it could be other things. And how do you develop those skills? I'm not going to go into all the details of DBT. That's covered in the books that we have in our Wounded Healers course. That's covered in several other lectures. But one of the things I would say is almost all of our addiction counseling courses, so these are all the addiction counseling courses that we have, are going to be giving you tools that will be helpful for a lot of that emotional management. If you're wanting to go deeper on the emotional management, these are a lot of the courses that we have. So these are at the undergrad level. We also have, I think 15 courses at the graduate level. We have 33 total addiction counseling courses. So hopefully all this is helpful. And I realize managing emotions is one of the most difficult things. A key part of making progress on that is to recognize that often the emotions are secondary to other things that you can influence, like, self-care and, thoughts and things along those lines. So hopefully this is helpful. If you have questions, please talk with your faculty member.